Hi, I'm Jordan Rubin, and welcome to Ancient Medicine Today. If you are someone who is suffering from dementia, Parkinson's, or Alzheimer's disease, or if you care for someone, know someone, love someone that is concerned for their brain health, you do not want to miss today's episode. We're going to talk about essential oils for Alzheimer's symptoms, but this also goes for memory loss, dementia, and Parkinson's. Folks, there are millions of people that are suffering from age-related neurodegeneration, but we all know that you don't have to be older to suffer. Let's find out how we can use these ancient oils as ancient medicine for this disease that is destroying the well-being and quality of life of so many Americans. Let's get started. Alzheimer's is considered an incurable, irreversible, progressive brain disorder. More than 5 million Americans have been diagnosed with Alzheimer's disease, not to mention some undiagnosed. This is crazy. 2/3 are women. I didn't even know that. And we believe essential oils may help manage these symptoms of dementia or Alzheimer's disease, and most of them can be used right along with any medication or other treatments. In fact, a recent study showed that the aromatherapy, the inhalation of rosemary, lavender, and citrus works effectively as a non-pharmacological therapy for dementia patients. That means it is non-pharmaceutical and it still works. Patients showed improvement in cognitive function after regular inhalation of essential oils. All you have to do is pour them on your hand, inhale, or this is the most affordable product of all, you just open the bottle and inhale it. You can also diffuse it with a home diffuser. There's car diffusers, but this is something that is a no-brainer for anyone with Alzheimer's, dementia, or Parkinson's. What are the best oils for dementia or Alzheimer's? Rosemary. This is a great brain oil altogether. It's also great for your hair. You can diffuse it. You can rub it on someone's feet. If you're a caretaker for someone with dementia, Alzheimer's, or Parkinson's, you can absolutely do this. And rosemary is reported to help promote the regeneration of neurological tissue. This is a way to do it too. Apply topically under the nose and across the forehead. Dilute if necessary. And here's a safety tip. Do not use rosemary if you're dealing with high blood pressure or epilepsy. Frankincense, so potent, so powerful. This resin oil improves cognitive health and cognitive response. It's used in Alzheimer's, dementia, and brain injury. Take 2 to 3 drops internally, mixed in water or juice, etc. Diffuse or apply topically to the back of the neck, under the nose, and on the feet. It is very gentle and mild. Frankincense can have blood-thinning effects when taken internally, so be cautious if you are on blood thinners. Lavender, check this out. 2013 study found that taking 80 milligrams internally of lavender, that's a little more than 1 drop of oil, alleviated insomnia, reduced anxiety and depression, and improved Alzheimer's symptoms. That is awesome. When using lavender internally, find one labeled as a dietary supplement and make sure it's certified organic. You can diffuse, add to a warm water bath, apply to the temples, wrists, and the soles of your feet. It is well tolerated by most people, but don't use undiluted around pets. Bergamot, which as you can see is a citrus fruit commonly used in Asia. It's a mood-elevating and calming agent. Rub 2 to 3 drops onto your hands, as I mentioned. Cup, breathe in slowly, and you can apply to the feet and back of the neck. So here's safety tips for bergamot. Avoid using around pets. Avoid direct sunlight after external application, and monitor blood sugar levels regularly if you have diabetes. By the way, they are calling Alzheimer's diabetes type 3. So many people with Alzheimer's, Parkinson's, and dementia also have diabetes, need to be careful with using bergamot. Lemon. Lemon is so good. Lemon oil can be used very frequently, and it's very versatile. You can make it into a candy mint and a floor wax. Is it a candy mint? Is it a floor wax? You're both right. I know this is a serious matter and I'm making jokes, but really, lemon oil is delicious and it smells wonderful. When I diffuse lemon oil, someone walks into the house, immediately they make a comment. Lemon oil helps to prevent premature aging, improve cellular function and memory. Diffuse, apply topically, or consume orally to boost your brain. Again, avoid direct sunlight after external application and consult with a vet before using around cats. What do pets have against essential oils? Anyway, just be cautious if you have a pet that you love. Sandalwood, the masculine essential oil, also good for women, promotes mental clarity and memory, very historically celebrated, 2 to 3 drops topically to wrists and under the nose. If you're sensitive, dilute with a carrier oil. Geranium, sort of like a rose petal, works with natural chemistry to help prevent memory loss. Rub onto your temples, wrists, and the back of your neck. Avoid during pregnancy, and if sensitive skin is something you have, dilute, at least just try it and maybe eliminate its use, but it's really good for most people. Melissa, otherwise known as lemon balm, is one of the most studied oils and botanicals for Alzheimer's. Reduces symptoms of agitation, can be used daily in a diffuser, smells wonderful, again, avoid during pregnancy, and dilute diffused oil if you're around dogs or cats. Now, obviously, these oils that you're dealing with if you're pregnant, most often someone who's pregnant, thank God, doesn't have Alzheimer's or dementia, but if you're a caretaker of someone who does and you're pregnant, pay attention to this. Turmeric. What is turmeric good for? Answer, everything. Turmeric oil contains not just curcuminoids, but turmerones that support regeneration for neurologic conditions. Apply topically, take internally, and here's a safety warning, don't wear a white shirt around turmeric application. It will stain. It even stains white sinks if you don't rinse. I like it in smoothies, and yep, I have an orange blender. Serves me right, and it serves me well. Make sure that you don't ruin fabrics or clothing. Folks, Ancient Medicine today is here to help you use food, and in this case, essential oils as medicine. If you are concerned about keeping your brain healthy, which by the way, more people are concerned about getting Alzheimer's and dementia and Parkinson's than they are cancer. It's horrifying to think about losing your mind. A lot of us have had loved ones that have suffered. It is terrible. If you know someone or love someone who needs this information, make sure to share it right now because we're going to recap. Essential oils for Alzheimer's, Parkinson's, dementia, rosemary, frankincense, lavender, bergamot, lemon, sandalwood, geranium, melissa, and turmeric. Make sure to rewind this video to check out certain safety precautions. Some you use internally, some you use externally, some you dump on your hands. Breathe in. Bottom line, folks, if you've got neurodegeneration or brain issues, there is no reason you shouldn't use essential oils. They've proven to be safe for thousands of years, and they might just be what the doctor ordered for your loved ones dealing with Alzheimer's, Parkinson's, dementia, or even memory loss. So if you love this information, make sure to share it with someone who needs it. Subscribe to this YouTube channel to get alerted when we launch a new program, which happens very, very often. And make sure to tune in next time to Ancient Medicine Today. I'm Jordan Rubin. Thank you, and have a healthy day.
Hi, Dr. Axe here. I want to say thanks so much for checking out this YouTube video, and also don't forget to subscribe if you want to get more great content on things like herbs, essential oils, natural remedies, and how to use food as medicine. Also, check out more of our content on my YouTube channel. Thanks for watching.